Here, and every Friday we like to wrap up the week by checking in with Dr. Ross Goldberg, who works at Valley-Wide Health, and he's also president of Arizona's Medical Association. So, Dr. Goldberg, thank you for being here. Again, I appreciate you taking some time with us. And one of the things I really like talking to you about, and the reason we like talking to you, is because you have a nice overview of what's going on because of your role with the Medical Association there and what's going on. So, one thing that I found very encouraging this morning was, again, we're dropping down the number of people in the hospital because of COVID, down about 600 people over the last 2 weeks. How significant is that, 600 people with our hospital system here in the state?
Well, first off, good morning. Thanks again for having me. Yeah, it's hopeful. I'm cautiously optimistic. I can tell you from our standpoint in the hospital, we're kind of plateauing right now, which is okay. It's better than going up. We're just taking it one day at a time right now with our resources, taking care of people, and really kind of just taking it slow to make sure that we're continuing down the right path.
Tell me about your plateau right now. First of all, where is your hospital located? Are you in an area then? I mean, if we see these metrics going down and you in particular are plateauing, where are you in town, and are you in an area that seems to be a little harder hit?
So Valley-Wide Health is located at 24th Street in Roosevelt. We're near the airport, actually.
Okay.
So kind of we're in that part of Phoenix. You know, we're in Maricopa County, which is obviously the largest county that's obviously dealing with this. It's really just a matter of seeing where we are. Our numbers are kind of holding steady. We'd like them to go down further, but obviously that's going to take time. I think the thing we always need to remember, and I keep on repeating, is that everything is time delayed. So, you know, you actually mentioned it in a previous segment that, you know, positive cases then become hospitalizations. And so there's always a 7 to 14-day time delay. So hopefully we're seeing all the measures we're putting into place have some positive effect, and hopefully can keep that going.
So, and I never want to put our doctors in a political situation, but the governor yesterday came out and talked about getting back to school. And one of the things he said is he wants to see every single district, he's going to let districts decide things, but every single district has to have at least one location where students will be back together and going to school again next month. Your thoughts on younger students and, you know, all the way up to high school getting back together as early as next month?
Well, again, like anything, it's a pretty complex issue to address, right? We all recognize and understand the benefit having in kind of person learning is not just from the educational value, the social value, all of that put together is important in children's development. But we also have to be mindful and keep people safe. So my recommendations would be is to have a plan where you can kind of accomplish that. It's not easy to do. There have been some recommendations out there and people are getting creative. It's a matter of balancing all of those important pieces while keeping children safe as we learn more. That's the trick, is that we learn new things each time. So we're evolving as we learn more about this.
Right, and I'm sure it'll be watched very closely. Do you have to get that? I don't want to stop you from going somewhere.
No.
All right, and we're almost out of time. So just in a few seconds, if you can, how is your staff holding up? I mean, you're saying you're plateauing. I know you guys have been at a very high level for months and months. How's everybody doing?
Everyone's hanging in there. We appreciate that the resources are available of bringing more people in. I know that was announced last week. We're hopefully going to see them soon. That will help. Again, I give all the credit to our leadership that they are being very transparent and forward with what's going on. They're telling us and keeping us in the loop. And we're all in this together. And we appreciate the support that you're providing and others. And we appreciate people listening and hearing what we have to say and continuing to work with us as we deal with this.
Dr. Ross Goldberg, always good talking with you. We'll see you next Friday. And thank you again for all you're doing in our community. I appreciate it.